Welcome back to the Moonshot Podcast. Now we're going to talk about software, the invisible problem of access to your health information and your ability to do something about it. We're going to be talking about this with Stephen Gillett, the CEO of Verily, one of the Moonshot graduates from X. Stephen, in his past life, has been a chief information officer for Starbucks. He's been the president of Best Buy. He's been the chief operating officer of Symantec. And he was the CEO of Chronicle, the moonshot from X for cybersecurity, which we're talking about in a separate part of this podcast. So let's hear what Stephen and the Verily team are building. Welcome, Stephen.
Hey, it's good to be back.
We're going to be talking about healthcare and how to try to help people in a way that is very different from the way that healthcare currently works today. Under your watch, you moved from COO to president, and now Andy Conrad has handed it off to you. You're the CEO of Verily. You've also done a bunch of evolution of what Verily is. You've sold off some of the sort of sub-businesses or product areas to help Verily focus. How are you feeling about this really exciting, super innovative healthcare business?
I'm excited. Verily's mission, it was, how do you bring the promise of what we call precision healthcare to everybody every day? Right now, if you look at access to healthcare, it's disparate. You have some groups and communities in the U.S. that have great access to healthcare, and you have some that have very poor access to healthcare. What if there's an urgent clinic in your pocket every day with any specialist you need? And rather than wait 6 months for this, 3 months for that, there's a huge need and demand for healthcare that doesn't exist. 97% of the healthcare data that matters to you is stuck behind firewalls today. Your hospital, your clinic, your specialist, your large academic medical center, and they provide great services, but trying to get access to that data and make it relevant for me is elusive.
You have an app called Verily Me, and you suggested that I sign up, and the app said, just give me your name, your phone number, and we'll get all of your medical history. And I believe in you. I believe in Verily. And even so, I was like, I don't think that's going to happen, because I know how many different random hospitals have these like weird little bits and pieces of, I did that MRI over there. I did that X-ray over there. I don't even remember where most of this stuff 1, 2, 3 decades ago happened. And it's all HIPAA. HIPAA is the regulation about privacy and security that says healthcare data has to stay really locked down. So I thought, chances that this app can go get all of my data are zero.
Yeah.
And the next day it said, here's all of your medical history. And I thought, what? How did that happen? How does it work?
So what Verily Me does, which is quite differentiated and extraordinary, is like you said, it's available on the App Store, so you can go download it. You take a selfie, and then you take a picture of your driver's license, and then we're both a technology company and a medical provider. We make a records request as a clinical provider of care for you.
Got it. So almost no tech company could do what this app did, because they don't have the standing as a medical provider to ask for the Astro data as a medical provider for Astro. Give us 2 or 3 examples. What happens if you're really looking at somebody's data? How can you make their healthcare more precise?
When you're looking at Verily Me, our AI capabilities, we call her Violet, is talking and running on your data privately. You start having a conversation with your medical data, which no public chatbot can do and no single institution can do. And so when you're asking questions around, is my blood sugar okay? Or should I change my medications? Or would you tell me if this new vitamin I want to have is bad for anything you see in my medical records? Or I'm going to meet my endocrinologist next week at my hospital for a checkup based on my history. What are the top 10 things I should be talking to them about? So the artificial intelligent chatbots that we all use, they don't know anything about your medical history. And I'd recommend do not put your medical data on the open internet or upload it to the public chatbots.
Somewhat notoriously, these chatbots are not perfectly reliable. You're offering to give them something that is more precise because it's based on their data. How are you working to make sure that Violet lives up to a higher standard.
We have clinicians, physicians, scientists looking at questions and queries that are coming in as we train. We actually try to be very conservative because there's a difference between you talking about your medical records than, I'm having shortness of breath. What do I do? Which we will immediately, kick that out to, you need to call 911. And Violet is not giving you your primary care. Now, over time, we think that could be a future that we bring in, but we have to go through the proper steps.
So that sort of begs the question, where do you think all this is going? Like, best case scenario, I know you can't promise it, 10 years from now, how has Verily changed the world?
We also believe at some point the industry will get to full self-driving equivalent, which is full autonomous care. I think the technology is largely there, but medical data is not available on the internet. So no matter how much you invest in these large language models that exist today, it's not getting all of the data you're going to really need to understand before you start doing primary care through the capabilities of artificial intelligence. So we talked a lot about Verily Me, but the power of making all of that work is what we built over the last few years called Verily Pre, the platform. And the way that Verily Pre was built, and I give credit to our CTO and the engineering and product teams and all the regulatory and scientists that made that work, think of it as a purpose-built hyperscaler for healthcare data. The future of healthcare requires a medical-grade cloud hyperscaler in healthcare to process and understand all of this medical information at scale. Not just your personal medical records, but all of the healthcare information that is stuck behind these firewalls, whether it's government or whether it's academic medical centers or whether it's your regional healthcare provider. And we think Verily Pre, just like it does it for our first-party solutions that I just talked about, we think and we are seeing it can do that for the rest of the industry. I think this is a public-private partnership to make that happen. It's not just a technical one.
We had this world for at least 5 years where you could easily have talked to your doctor or a therapist by Zoom or Google Meets. Insurance companies weren't signing off on that. And then when COVID hit, all of a sudden, because there was no other way to talk to your doctor, that became okay. Do you think another crisis like that is going to be needed to get us up the stack of autonomy in healthcare?
I think it'll be a mixed response. How do you take the rural farmer in Iowa and give them access to a specialist in which there is no specialist in the medical system that they're trying to get treatment at? And we think artificial intelligence eventually could be that fill. So I think it's not so much about there's going to be a step change, and it's more about here's how these technologies can be deployed to bring great, robust healthcare to groups around the United States and ultimately the world that don't today have access to great healthcare.
It's a really inspiring vision. Thank you, Stephen, not only for being a great leader and making sure that Verily turns into an enduring business, but for having done it twice for ex-graduates. Thank you so much.
Thank you.
This is the Moonshot Podcast, a peak action production for X, the Moonshot Factory, with me, Astro Teller. You can find more episodes wherever you get your podcasts and on our YouTube channel. If you want to take your own moonshots, we've developed a masterclass certificate course. Check it out in the show notes below. If you enjoyed this podcast, don't forget to subscribe. It helps other people find out about this series.